Good evening. Kiran, can I start?
Yep.
Kiran, can I start? Hello, Kiran. Yeah. Okay, okay. Thank you. Good evening, everyone. Shubho Shanda. In this hours of pandemic, the main burden lies on the patients of kidney diseases. So this evening, we will be having a talk on kidney care during lockdown. For this, we have for this evening we have a speaker, Dr. Rabi Ranjan Shah Mandal. Dr. Rabi Ranjan is a consultant nephrologist at Shanoka Hospital, Durgapur, West Bengal. I would like to just give a brief introduction of Dr. Rabi Ranjan. Dr. Rabi has done his bachelor's in medicine and surgery from Calcutta National Medical College and did his master's from the same premier institute. After that, Dr. Rabi did his MRCP from Royal College of Physicians. And furthermore, Dr. Rabi has specialized in field of nephrology by doing diploma in national board from Rabindranath Tagore International Institute of Cardiac Sciences. So welcome, sir.
Good
Welcome, sir.
evening. Good evening.
So first of all, I would like to thank you, sir, for precious time in these hours also for having a word with a number of patients who are suffering from CKD. So before we start on, sir, I would like to just I would be requesting you to give you lights on how to take care of kidney diseases and patients suffering from kidney diseases. Start with this. What are the dialysis modalities a patient should take care? So over to you, sir.
Very good evening. Thank you for inviting me and give some views of mine and all the nephrologists regarding this dialysis modalities and different modalities of chronic kidney disease treatments. These are very, what I say, it's very pertinent in this pandemic situations, because for the last 1 or 1.5 years time, we are basically suffering from this pandemic, and it's making us almost disabled and homebound, and all the normal patients who can enjoy their life at home, but the people who are suffering from chronic kidney disease and the end stage renal diseases, and who are basically dependent on some kind of dialysis modalities, they have to come to hospital, and they have to visit hospital very frequently for their management purposes. And we know that dialysis machines, hemodialysis specifically, are available in certain centers, and they have to travel a long distance to get to those centers and get their dialysis. And more so, these modalities are being done so frequently, like twice or thrice a week, and they have to spend a much valuable time in the hospitals or the dialysis centers where they are going for their dialysis. So people have to face several problems regarding their transportations. And as far as the hospital and dialysis centers are concerned, they are being exposed to a very high amount of viral loads, because people suffering from different kind of infections as well as the COVID infections, they are also coming to the hospitals, and these dialysis patients have to attend those hospitals because to get their dialysis. So this is very pertinent in this COVID scenario, and actually they are suffering a lot. We have seen people not getting dialysis during the last year, but situations has somehow become better in this year after several government initiations, as well as the private hospitals are also taking good initiatives so that people don't miss their dialysis schedules. And regarding the dialysis modalities, we have the kidney disease of several kinds. Some are temporary, some are permanent. And when these kidney diseases are permanent, we call them as chronic kidney diseases. And when they reach the end stage renal disease, that point of time when their glomerular filtration rate, which we calculate by several formulas, and from where we get a glomerular filtration rate of around 7 or 8, and the patients will have some kind of uremic symptoms like nausea, vomiting tendencies. They can have pruritus, very high blood pressure which are not being controlled, shortness of breath, recurrent anemias requiring blood transfusions, and electrolyte imbalances like potassium gets high. And these kinds of scenarios where the time has already come to put the patient on some kind of dialysis modalities. And we have mostly three kind of dialysis, what we say this as renal replacement therapy. And the most available one is the hemodialysis, and another one is peritoneal dialysis, which in the method by which we put some water into the abdomen and bring it out after some time, and that will bring all the toxins produced in the body. So this is known as the peritoneal dialysis. And the third modality is the renal transplantations, which we will not discuss in this present scenario. So regarding the hemodialysis, these though they can be done in home, but these home dialysis are not very available in our country. That is being practiced in different other countries, like in European and American countries. And India is somehow gaining some pace regarding the home dialysis, but it's too costly for the patient. So people have to rely on the center-based hemodialysis sessions. So the hemodialysis per se, we have to bring those patients to the dialysis centers twice or thrice a week, and we have to do dialysis for around 8 to 12 hours per week. And for that we have to divide those total 10-12 hour sessions into 3 sessions, so that people can get 3-4 hours of dialysis sessions, or we can divide into 2 4 hours of dialysis sessions. So people have to come to the in-center dialysis to get their dialysis, and they have to visit the centers very frequently. Hello? Am I audible? Hello, am I audible? Okay. So we can go on regarding. We'll be discussing some facts like we have already discussed that why dialysis is basically a challenge in this COVID era. People have to rely on the transportation, and the public transports are when people have to get into the private or in the public transportations. They have to come to the very crowded places where they have very high risk of getting that COVID infections, and also in the hospitals where they can get that virus also. So people have to, what a dialysis patient should do when they come to the dialysis centers. What we ask the people or the patients who are on dialysis to keep themselves updated regarding the symptoms of COVID, which are usually the fever, the sore throat, or any cough, running nose, any malaise, body ache, or any diarrhea-like situations. If they are having some these kinds of symptoms, please notify these symptoms to the dialysis technicians or the receptions where they are getting the first contact with the dialysis centers, so that they can be easily isolated or quarantined, and they can be tested for the COVID. And people should not be afraid of getting tested, because if we identify them as early as possible and with efficient manners, we can isolate them or quarantine them. At the same time, we can provide dialysis to those patients. And giving dialysis is not an issue, because most of the centers have already been told that if you are having a center who is having a separate isolation center or the separate dialysis machines available for the COVID patients, it's good. But if those are not available, they can be given dialysis in non-COVID dialysis machines also, provided the patient should be brought to the dialysis centers at the last session of the dialysis. And after the dialysis session is over for the COVID positive patients, all those machines and the surfaces should be cleaned properly. And when a patient comes to the dialysis center, they should wash their hands properly by using soap, or for at least 20 seconds, or you can use the hand sanitizers. Always wear the masks. Usually the N95 masks are the best one available in the market, but there are different other kinds of cloth masks that are also available. It's better to have, if you are having a cloth mask, it's better to have two masks at the same point of time, and not to remove those masks when you are in the hospital or the dialysis center. And we are asking patients not to take food during the dialysis sessions, because that you have to remove those masks from the face, and you will be exposed to some kind of infections, specifically the COVID infections. And yeah, many people who are suffering from COVID, who are actually on dialysis, they ask that what should we do if we get positive for COVID? So we ask them not to get panicked. Get consulted with your physician or the nephrologist. You will be getting some medications for that, and if monitor saturation at home. If it is less than 94, 90 to 94, it's a moderate disease. You can still manage at home, but with caution. If there are some red flag signs like persistence of fever for more than 7 days, and if you are having severe bouts of cough, which is bringing down your saturations to less than 90, and there are some kind of symptoms like feeling shortness of breath on walking, or minimal exertions. Suppose you are going to the toilets and you are panting like anything. So all these kind of symptoms are supposed to be red flag signs, and when you should consult your physician and get admitted. Otherwise, a patient who is having a saturations of more than 94% can still be managed at home. So whenever a patient on dialysis gets tested for COVID, they can be dialyzed in a separate center where the COVID positive machines are available. If not, they can be still given dialysis in the negative machines at the night shifts or the last shifts of the dialysis, and after that, the centers and machines and the surfaces should be cleaned properly. so that the next morning when the negative patients come, they don't get the infections. And if possible, we have to if the suspected patients are getting dialysis in the same sessions, we have to make a barrier, or we have to arrange for a safe distance of around suppose 2 meter distance from the negative patients, and we should not use the same technician for the negative patients and the suspected patients. So you will be feeling safe in the dialysis centers, and the risk of exposure from the other persons or patients who are having COVID, we have to minimize them. So giving dialysis to the dialysis dependent patients is priority to the nephrologists, to the physicians, and to the dialysis centers, and that should not be denied in this present scenario. Um, Now, people often ask us questions. I have been tested positive, and I am doing dialysis in positive machines. When should we be shifted to the negative machines, COVID negative machines, and we can get our normal schedule of dialysis? So that's a tricky question, because from last year we have seen several changes in different recommendations. And so far, the recommendation which is still standing is, if you are getting positive for COVID-19, you wait for at least 2 weeks time to and get your dialysis from the positive machines. And if you are tested to be negative after 2 weeks time, or suppose you are getting a positive result even after 2 weeks time, you again wait for another week and get tested, and if it is negative, you can be shifted to a negative machine. Now, regarding some things people will ask whenever they come to us to the chambers, and they ask what should be our diet in this present scenario, because COVID is infection which brings your immunity down to the zero level, and we have to rely on our nutritious diet so that we remain healthy during this time. And people who are on dialysis, they have to take a good nutritious diet, especially rich in protein diets, because we all know during the dialysis people lose good amount of protein in their dialysis. So they have to take good amount of protein diets. And sometimes people who are CKD patients and not on dialysis, we often ask them to bring their protein down, so that the progressions of chronic kidney disease is not so fast. So, but at the point of time when they are converted to a patient who depends on dialysis, the protein requirement of those patients get high, and they have to take high protein diets, and to get their nutrition good. And sometimes a low protein diet in dialysis dependent patients can bring their albumin down. They can have certain kinds of swellings, they can have lethargy and malnutrition also. So we ask them to avoid those malnutrition by taking good amount of protein diets. And of course, the fruits and vegetables, we have to be choosy in cases of dialysis dependent patients, because we know most of the fruits are rich in phosphates and potassiums, and so we have to avoid those food. Those who are chronic kidney disease patients and the dialysis dependent patients, we should cut down the intake of high potassium and high phosphate containing food. So one question people often are asking regarding the vaccinations of the CKD patients and the dialysis dependent patients. And I would like to say that vaccinations is to be taken at the earliest point opportunity when they are available, because availability is an issue right now. But CKD patients who are on dialysis or off dialysis, they always should take that vaccinations to get protected from the vaccine from the COVID infections. And it's not that these vaccines will provide 100% preventions from the disease, but at the same time, if you are getting vaccinated, the disease severity will be low, and the rate of hospitalizations and the rate of requirements of oxygens and to get the severe or disease or the mortality rates, that is certainly coming down with the vaccinations. And though large scale studies are yet to be done on the CKD patients regarding these vaccines, but whatever the vaccines those are available right now are considered to be safe for the dialysis patients, and they can take at the earliest opportunity. And now the thing that COVID infections itself can cause kidney diseases. Some people who are having some kind of chronic kidney disease, but they who are not dialysis, or those who have not reached to end stage renal diseases, can have their renal diseases get accelerated to reach the end stage renal diseases, and they can be put on dialysis also. So around 5 to 25% of cases of acute kidney injury have been reported in different case series after these COVID infections, and people, those who have high different kinds of comorbidities like diabetes, hypertension, obesity, they are particularly at risk. And other than those comorbidities, certain kind of drugs which are being used, they can also put these patients on a risk of having acute kidney injury. And the COVID infection per se can cause a cytokine storm, which can cause the acute kidney injury itself. So people who was absolutely fine as far as the kidneys were concerned, and whenever they are getting COVID infection, they can have acute kidney injury. A person who was already a chronic kidney disease patient, not on hemodialysis, they can have their kidney disease accelerated because of these COVID infections or some comorbidities, or by certain drugs, and they can reach to the point of dialysis. And the dialysis patients who are already on dialysis, they can have certain kind of problems like the nutrition, because we all know that the taste is almost gone in during this COVID infection, and people have severe anorexia, and people don't want to eat. And we have to ensure the adequate nutrition for these CKD dialysis patients, so that they can cope up the situation, and their nutrition can be improved. So this is regarding few things which I wanted to discuss with those patients who are actually suffering a lot in this COVID pandemic situation. I will like to have some questions if you have any, and I can discuss them if you want. So somebody, Sutirtho Nandi, is asking, my father's creatinine is 3.13 and hemoglobin is 8.5, whether dialysis is required or not. So only the creatinine is not a definite marker on which we rely as far as the dialysis is concerned. So only the creatinine should not be a parameter which we look for the dialysis initiations. We have to check some clinical perspective also, like if a patient is having recurrent anemia requiring blood transfusion, or the patient is having severe shortness of breath, or there are features of volume overload or excess of water in the body which the kidneys are not being able to excrete, and if the patients are having some electrolyte abnormalities or metabolic abnormalities like metabolic acidosis, and certain kind of situations where there are very high phosphate levels or electrolyte imbalances. So only the creatinine value is not the marker on which we rely upon for the dialysis initiations. Only if you provide me with that much of information, I will say no, it's not the right time. So we have to check other factors, and that can be discussed with your physicians. Mr. Ibrar, are you there? Any questions? Mr. Ibrar? Okay, some questions from Anindita Choudhury: how to improve hemoglobin on dialysis patients. So, regarding the dialysis dependent patients or a CKD patients who is a end stage renal disease patient, they can have different kind of anemias. It can be iron deficiency anemia, or it can be of vitamin deficiency anemias. It can be because of the deficiency of erythropoietin hormones, which is being produced by the kidneys and is helping to build up your hemoglobin level. It can be because of some blood loss, or different kind of mechanisms can be there. So to improve the hemoglobin level, we have to check what is the reason for your lack of hemoglobin or the low hemoglobin level. And mostly these are because of the iron deficiencies, because of the blood loss from different sites, or because of the deficiencies of iron and the vitamins in diet. And more so over the diets are being Indian diets specifically, they have less amount of proteins and animal proteins, which are being considered to be on the high rich in iron. Source of iron is usually the animal proteins, and it is mostly deficient in Indian food. So iron deficiency anemia is one of the most common cause of anemia or low hemoglobin in dialysis patients. And as well as all the patients who are on dialysis, they definitely have some sort of erythropoietin deficiencies, because that hormone is being produced in the kidneys. So as the kidneys are not functioning, the kidneys ability to produce that erythropoietin hormone is also low. So we often have to rely on supplementing iron and erythropoietin in dialysis patients. And as far as the iron is concerned, there are several oral or intravenous preparations which are available in the market. But what we want to say that during the end stage renal disease or advanced kidney disease stages, the oral iron hardly helps. It is not being absorbed in your gut, and it will hardly help in improving the hemoglobin level. Though initially we can try with oral iron therapy, but we have to rely upon on intravenous iron therapies. And the different molecules are there in the market, like iron sucrose, iron carboxymaltose, and these are being prescribed by the nephrologists, and those are to be given during the sessions of dialysis, usually at the end of the dialysis sessions. And erythropoietins are also available, and newer congeners like darbepoietins are also available in the market. Some oral erythropoietins will be coming in next few years. They are on clinical trials, and when they will be available, that will be easy to take, and because they will be oral. So iron and erythropoietin are the most mostly prescribed medicines for the dialysis dependent patients. But we also have to remember that only these two are not the reason for anemia in CKD or dialysis dependent patients, and we can have several other reasons, and we have to investigate whether this anemia or the low hemoglobin is only because of the iron or erythropoietin deficiencies, or because of some certain other reasons. If those are the reasons are different, then we have to treat them differently. Okay, some Obhisek Moitro is asking, if my kidney problem is chronic, how long can I continue without dialysis? So, a chronic kidney disease have 5 stages. So, from 1 to 5, and the fifth stage is considered to be the end stage renal disease or the chronic kidney disease 5. So, whenever a patient who is on chronic kidney disease stage 5 and is having certain kind of symptoms, then only we ask the patients to start the dialysis therapy. And it depends on the amount of protein your kidney is excreting, as well as the GFR, which we calculate from different formulas, and that can be easily derived from the creatinine which you are testing on regular basis. So usually when the GFR is less than 7 or 8, and the creatinine, which usually goes up around suppose 8 or 9, and not only this, we have to depend on certain clinical markers, like if the patient is having anorexia or the loss of appetite, and there are several episodes of vomiting, and the patient is not taking adequate nutrition, and is having some kind of shortness of breath, any electrolyte imbalances, then only we ask them to take the dialysis as a modality of therapy. So certain kidney diseases in chronic kidney diseases can take suppose few months of time to end up into dialysis dependent scenario, and certain diseases can take years together, suppose 10 or 15 years time. So for different disease, the chronic kidney disease can take different time span to end up into dialysis. So it's in a simple sentence, I cannot say suppose you will be having 6 months of time or 6 years of time. So different disease have different nature of their progression towards the end stage renal disease. So it's a bit difficult for me to say at what point of time you will be getting dialysis. It depends on the etiology or the cause of the chronic kidney disease. Sita Narla is asking, what is the ideal kidney diet for older patients during COVID? So I have already discussed that COVID is causing different problems, like they have very less taste sensations, and or sometimes in some people the taste is almost gone, and people often don't feel to get food, and they have severe loss of appetite and not taking food. So one of the cause is the loss of taste sensation, and as part of the generalized weakness, people are often avoiding some kinds of food, and we have to rely on nutritious diet. Like people who is on dialysis, they have to take high amount of protein diets, and the protein are usually the white of the eggs or the fish or chicken, or you can have the paneers, or any kind of cereals. Okay, so all those food are rich in protein. So protein diet is most important for the dialysis dependent patients. And if a patient who is not a chronic kidney disease patients, they can take all kind of food, including the fruits and vegetables. As far as the CKD patients and the dialysis patients are concerned, we often have to monitor and check the potassium and phosphate levels, because most of the food which are and the fruits are also very rich in potassium and phosphate, which can cause problem to the chronic kidney disease patient. So we often ask them to avoid the fruits, except some fruits. So the nutritious diet includes all kinds of cereals and protein rich diet that should be taken for the CKD patients. Any other questions? So if there are no more questions, so we can finish the session here. Hope all my patients will be having a good diet during this pandemic and will have no problem in getting dialysis. And because the dialysis dependent patients actually rely on these dialysis sessions, and without these dialysis sessions they can die. So we one more thing I would ask the patient not to skip your dialysis sessions, if at all you have to skip for different reasons because of the transportations which are not available right now. So what you can do is, my suggestions will be, you can bring your dialysis frequency to from 3 to 2, but at the same time you have to be very cautious regarding your fluid intake, water intake, and any suppose like extra salt intake has to be avoided. And if you are taking dialysis for twice a week, then you have to be very cautious that the total duration of dialysis should be around 10 hours a week. So it's better to get all those dialysis sessions. Suppose a patient who is on 3 times a week dialysis, you please get those 3 dialysis sessions. If it is not possible, at least you take 2 dialysis with certain increase in the duration of dialysis time. Suppose it was 4 hours previously, so you can take 5 hours of dialysis twice a week. But it's always better to get the frequent dialysis or the 3 times per week dialysis. So I will ask them to not to skip dialysis, and if you have to, then total duration of dialysis should be around 10 hours at least per week. Okay. So thank you for joining. Hope we have discussed some of the mostly asked questions from the dialysis patients to the nephrologists or the physicians. And these COVID situations have made their life almost like a hell. And even they cannot enjoy their life at home because they have to come for dialysis purposes. So I feel sympathetic to all my patients, those who are on dialysis, and hope they will be soon getting their dialysis in their corresponding centers without any problem. Thank you. Hope you have my informations which I have provided will help, and thank you for joining.